Oncology medical billing services. What are some of the common problems with medical billing? Many people facing cancer are faced with the daunting task of navigating medical bills and insurance companies. Medical billing mistakes can lead to unnecessary stress for patients and their families. Medical billing mistakes occur in all medical billing companies. These errors can be caused by careless medical billing employees, errors in medical billing software, and fraudulent practices by medical billing companies. While they are rare, they can result in severe financial losses. These errors are common because medical billing companies have strict deadlines and must process claims quickly. These deadlines are often set by insurance companies. Medical billing companies must understand these deadlines in order to meet them. If a deadline is missed, the medical biller is penalized. Medical billing mistakes come in many forms. These include incorrect coding. Medical billing companies must use a specific code for each procedure. When a medical biller uses the wrong code, they will not get paid correctly. This is one of the most common billing mistakes. Failing to identify the required information on the medical biller form. Failing to properly identify the patient's insurance company and procedure code. Failing to properly identify the service provider. Failing to properly identify the date and time of the service. Failing to properly identify the diagnosis. Failing to submit the claim in a timely manner. Not following up with the patient to make sure the claim is paid. Failing to properly identify the insurance carrier. Medical billing mistakes can cause a medical bill to be rejected, or the medical biller to receive a penalty. Medical billers are required to use medical coding and billing software to ensure errors are caught as soon as possible. Credentialing for oncologists. The term credentialing denotes the process of establishing a person's qualifications to be an oncologist. The credentialing process varies from region to region and from country to country depending on their respective level of medical regulation. In the United States, medical licensure is a state-level activity, which means that it falls under the jurisdiction of individual states rather than under a federal agency. The medical world is changing. Oncologists are being required to have more than just a medical license in order to keep up with the ever-changing tools and techniques of the trade. A new credential, Board Certified in Oncology, has been introduced by the American Board of Medical Specialties in an effort to better identify qualified physicians in the specialty so patients can be certain they are receiving appropriate care from a qualified physician. Optimizing your medical billing experience. Medical billing services are becoming increasingly important in the medical field. As the population ages and an insurance coverage becomes more expensive, more people are paying out of pocket. This has led to an increase in the number of medical billing companies that specialize in collecting unpaid invoices for hospitals and other healthcare providers. Although a lot of these companies have excellent customer service, it is important to remember that the first responsibility of a medical billing company is to collect money from patients, not provide excellent customer service. In addition, many of these companies have the reputation of being better than hospitals and other medical providers at recovering unpaid invoices. In order to receive payment, medical providers often have to go through the billing company and request payment. Contact Halfort for the best medical billing services. Contact us to learn more about the benefits of our oncology medical billing services and what we can do for your organization. Halfort has been providing quality medical billing services to healthcare providers for over 10 years, and is recognized as a world leader in healthcare solutions. For questions about medical billing, visit halfortmedical.com.